Welcome to the Southern Medical Association's Southern Medicine podcast. We are pleased to have Dr. David Joyner with us today. Dr. Joyner serves as Senior Vice President and Executive Director of the Andrews Institute. He is a board-certified orthopedic surgeon with a sports medicine emphasis. Welcome, Dr. Joyner.
Thank you very much. I'm very happy to be here.
Again, thank you for joining us today to discuss newer orthopedic modalities and therapies. Let's begin discussing blood flow restriction. What is BFR therapy, and what are the potential benefits to patients and athletes?
Well, blood flow restriction, also known as BFR, has been around for a number of years in relationship to building muscle strength and accentuating conditioning exercises such as strength training exercises. And what the principle behind that is that it's been known that blood flow restriction, you really apply, in a sense, blood pressure cuffs to your upper arms and maybe upper thighs if it's the lower extremity you're exercising. And by the restricting that blood flow, you get a much more, in a sense, stimulated result of your strength training and doing less reps and a higher result. And what happens is that we've seen changes in lactic acid, norepinephrine, increases in growth hormone, and this has helped build muscle strength beyond what you do without the BFR. So relative to that, though, one of our physicians, Dr. Adam Anns, thought, I wonder if there's a systemic effect with high-intensity exercise, and wondered if exercise upregulates cell mobilization in humans, which was shown to happen in rats. And the BFR initiates a sympathetic response. But what if we did an experiment to find out if there was a mobilization of stem cells, if you will? And it's interesting, with exertion as the key, in a study that was done at the Andrews Institute, it did demonstrate that there is an uptick shortly after this high-intensity exercise with blood flow restriction in your systemic stem cell production.
How can biologics potentially help graft healing and ACL reconstruction surgery?
Another area of interest is biologics or stem cells, if you will. Have a lot of interest, not just in oncology, et cetera, but there's a high level of interest in the orthopedic surgical world. And one of the theorems was, I wonder if by a controlled environment in augmentation of ACL reconstruction or anterior cruciate ligament reconstruction, which is an extremely common injury in athletics or anyone in an active population, such as skiers, et cetera. And the theorem was, if we augmented the reconstruction with the graft that you actually harvest from the patellar tendon of the individual having the ACL reconstruction, and then that becomes the new ACL, if you will. If we wrap that graft in an amnion collagen matrix wrap before it was reinserted back into that patient, and then injected bone marrow aspirate concentrated stem cells, would that affect the rapidity and the strength of the graft, and would that augment that and increase that? It's a very interesting concept.
What interventions are being studied to potentially assist in articular cartilage repair reconstitution?
So another thought with the use of biologics or stem cells is, can we utilize principles that have been utilized in the hematology and oncology world and apply that to orthopedic sports medicine, i.e., to pharmaceutically mobilize cells, which is done when you do, in a sense, a marrow transplant. And the same practice of stem cell collection, has been applied, and we're in a phase 3 study now with pharmaceutically mobilized cells. And then the cells are harvested by apheresis, and then those cells are stored over liquid nitrogen, and with about an 80% preservation rate. And what we have done is in a surgical procedure with utilizing a microfracture technique and repeated injections of those pharmaceutically mobilized stem cells to see if we can cause the regeneration, if you will, of hyaline cartilage, which is the cartilage that lines the end of the bone, which is the cartilage that goes away when you have degenerative joint disease or degenerative arthritis, as we say. We know that we've been able to generate scar cartilage, quote unquote, by doing those microfractures, but its makeup in the collagen matrix is not the same as what you were born with. It's not as good. So we want to see if we can actually cause to come back what you once had.
Why is this topic so important to discuss?
I think the whole idea in particularly orthopedic medicine, Dr. Andrews actually, per Dr. Andrews' statements, he believes that the arthroscope was, probably in our lifetime one of the major inventions or interventions in the world of sports and reconstructive or sports-like surgery. And lots of people have sports-like surgery that aren't professional athletes. It applies to the whole general population, females as well as males, as well as young people. And the use of these biologics look very promising. And the question is, we need to study them and decide on where they can be applied and where can they do the most good if they do really work.